Welcome back. How bad is the opioid epidemic and what kind of resources are there? Overdose is now the leading cause of accidental death in the United States for people ages 25 to 64, more than car accidents. In the first 3 months of this year, 276 people overdosed in Manatee County. 36 of those overdoses were fatal. Manatee leads the state in overdoses thanks to a state of emergency declaration. Florida will receive more than $27 million from the federal government to address the epidemic. However, the GOP health care plan could impact the coverage and ability of Floridians to get treatment. States opting to expand Medicaid could suffer even more, losing the addiction treatment mandate. And joining us for more on tonight's topic is PJ Brooks, Vice President of Outreach and Youth Services at First Step Addiction Recovery, Frank Alcock, a professor of political science at New College of Florida and an ABC7 political analyst, and Rod Thompson, president of the Sarasota Republican Club. And PJ, I'm going to start with you because you just gave us some incredible information in terms of your funding here on the Suncoast from the state, and what is it?
Unfortunately, we just received news this past week that our Mothers and Infants program that treats pregnant women who are addicted to chemicals is going to receive a $278,000 cut, which represents 35% of the overall budget of the program. What that translates to is we're estimating that about 32 mothers and babies will not get the care that they would have received at a major cost to our taxpayers.
And this is from the state budget, which, as we reported last week, was negotiated in secret and basically pushed out to legislators at the last minute to vote on?
Up until the conference that was held, the closed-door conference, our funding looked like it was safe, and then right after the meeting behind closed doors, the decision was made, we were cut. So it happened at the last minute.
Any explanation what happened?
At this point, we haven't received any. In fact, those that we have talked to at Department of Children and Families and our managing entity were shocked as we were when they found out that this had happened.
Gentlemen, I know that you can't go into the negotiations room up in Tallahassee, but you know, I mean, we can't be reporting more about the opioid epidemic. What could have possibly gone up in Tallahassee where you're actually cutting money to programs that treat women who are dependent on opioids?
Well, I think there's a number of things that go on in those last conference discussions where you put together the House and Senate thing. The main thing is that nobody knows what goes on unless sources leak things. So much is happening in an $80 billion budget that it's entirely possible that chunks such as this and the implications of them that PJ just outlined were not even realized during that conference because the budget is so large and complicated, number one. Number two, and this is something that is an ongoing frustration for me, and I'm pretty sure I'm not alone, is that you have such a closed-door possibility going on there. And you do because the legislature, just like Congress, is consistently passing laws for everybody else to live under that they don't. In this case, Sunshine Law. The county commission here in Sarasota, the school board, everybody has to live under the Sunshine Law that the legislature passed a long time ago, but the legislature does not, and that's a problem.
Frank, are you stunned because if there's anything that we know in Florida right now is that we are in the grasp of an epidemic that is killing, as we said, a record number of people, not only on the Suncoast, but from Miami to Tallahassee?
Yes, I'm shocked. It's frightening to think that the legislature would be cutting programs that are vital and so counterintuitive at this moment, but it is what it is. If not, then I'm even more shocked. I cannot understand right now why this program would be cut given the conditions.
Now, we also reported that we are getting millions of dollars in federal funding that we pushed through, and Vern Buchanan helped push that through to tackle the declaration of a state of emergency in Florida. But PJ, you also say there are some strings on that which does not prevent you from being able to do what you need to do.
The emphasis of the funding is towards medication-assisted therapy, which could include Suboxone, methadone, and Vivitrol. But unfortunately, it does not include access to residential treatment for individuals who need to be out of their community and get care, or detoxification services. So a big linchpin to success with treatment are those two efforts, and unfortunately those are not included.
We have only about 30 seconds left, but I'm wondering if anybody, whether they're in Congress or the state legislature, consults to actual medical and addiction professionals for the do's and don'ts here.
I think they cut first and ask questions later.
All right, we're going to leave it there for now. We are just getting started, and we'll pick up the discussion right after we check on the weather. Welcome back. If you're just joining us, we are discussing opioid addiction on the Suncoast and across the nation and how the American Health Care Act could impact treatment in some states. Our guests tonight are P.J. Brooks of the First Step Addiction Recovery, Frank Alcock of New College of Florida, and Rod Thompson of the Sarasota Republican Club. So let's get to the American Health Care Act. Right now, it is estimated 1.3 million Americans receive treatment for mental health and substance abuse because of the Medicaid expansion. Somebody who is with Johns Hopkins said that of the Republican health care plan, taken as a whole, it is a major retreat from the efforts to save the lives in the opioid epidemic. Rod, I know you're not for the Medicaid expansion, but what would you do here?
Well, I would put it more at the state level. I'm not for the for that Medicaid expansion. I wasn't for it at the time. I was glad Governor Scott didn't take it because this was going to be one of two things that was going to happen, either this or all of the rest of the cost was going to come to the state. So he was wise not to. So Florida is not facing any cuts in that area. But to me, in a philosophic level, this is the type of thing that where that government, which is closest to the people, is best. Really, as much as you can have local programs such as PJ, such as others, handling them. And I think that the county commission should be involved with this. I think that, you know, there's a lot of ways that this can be handled outside of Washington. Because here's the problem. I just want to say, just in a bigger picture, if I can, that there's no way that Washington can make a decision that's good for Butte, Montana, and rural Iowa, and Miami-Dade, and L.A. There's no way.
Okay, so left to its own devices, as we just reported, Florida is cutting $250,000 to First Step for residential care.
And I guarantee you there will be repercussions for that. And this is how the process works. There will be repercussions for that happening. I mean, there just will be. And we might find out there's more to it because, as we know, because it was done behind closed doors, like it always has been, behind closed doors, more may come out. But that particular decision, I think that they're going to feel repercussions for. They would from me.
Frank?
There's some legitimate cost concerns about Medicaid and certainly ideas for reforming that program or looking to best practices in other states. I do get that. But this is pretty simple. We're talking about millions of people that will not get treatment for both mental health and drug addiction if we pull back. For a million people you just heard, and probably going out in another 5 or 10 years, we're talking about millions. Medicaid coverage will be the difference maker to whether or not they get treatment. And so, you know, you can run around all you want. If you pull back on Medicaid, you're talking about millions of people that will not get treatment that could have otherwise gotten treatment.
Is it fair to raise the question about whether it is hypocritical to talk about being a leader in the fight against the opioid epidemic, but going to Florida, going back to Washington and voting for a plan that would actually cut coverage for it?
Well, but as I understand it, that budget actually increased specific coverage for opioid to Florida. That was something Vern Buchanan pushed for, and that was something that is consistent with what Trump has talked about on the stump. So I think there's some consistency there. What Frank is talking about is a broader issue in the cuts in the AHCA, but on the specifics of the opioid epidemic, I think that, you know, Congressman Buchanan and President Trump are consistent on it.
But correct me if I'm wrong. Once again, the strings from Washington, PJ, is that money that's coming into the state cannot be used for residential care.
Correct. We need this. We need the supports, and we need those dollars to be able to provide what care we can. The problem is it has a limited scope of care. But as we roll it out, you know, we're going to have individuals who are going to have access to medication-assisted therapies. But oftentimes, that should take place as they're getting into a detox facility or in a residential facility.
Frank.
And with the health care bill that's made it through the House, it's not just the low income. I think that's certainly, if there's one thing that I had to point to where the most people will be put at risk, it's at that low income bracket. It's sort of on the margins of Medicaid and where Medicaid is going, reformed or not. But there are other elements of the changes to our health care law that will allow health insurance companies to discriminate on the basis of income, age, a number of risk factors that probably will put a number of people that are vulnerable. They'll put them in a position where their cost of access is going to be increasing and they're not going to get coverage.
Let me ask you all this. There was a big story in the Tampa Times today about a local member of Congress to the north, Gus Bilirakis, who is in northern Pinellas County and Pasco County, who held town hall after town hall a couple months ago where people were pleading with him for inclusion of a lot of these things in the Republican plan, and he says, I hear you, I'm going to take it back to Washington, and he wound up voting for this plan anyway, saying, hey, it's going to go to the Senate, and it's going to be changed, and by the time it gets back to the House, you know, it'll be all good.
That's weak. I mean, I don't like that. It's going to go to the Senate, and the Senate will fix what we screwed up. I mean, that's not leadership in Congress at all, to be speaking that way. I don't care for that at all. But the bill also is creating a pool for low-income people. So that the problem is, when Frank was talking about how it allows insurance companies to do more, clearly what we have right now, not to get too far off track, but Obamacare is failing. I mean, Aetna's pulled out completely. You have so many of the major insurers have pulled out. It is a failing program, so it has to be fixed somehow. The AHCA is an attempt to fix it by ensuring that we don't lose the insurance companies in the market, that keeping them healthy enough to continue, while also providing a pool of money for the low-income people that Frank's talking about.
Frank, you have acknowledged that there are things in the Affordable Care Act that have to be fixed. Is this fixing it?
No, there are some elements of the Affordable Health Care Act that are working really well. There are some areas and markets, state and exchange markets in particular, that are not working well. So I think creating the low-risk pools, in principle, it sounds fine, but looking at the degree of risk that the individuals within this pool are going to bring with them, coupled with how much money is being thrown at it, the math doesn't work. One or two things are going to happen. The premiums are going to be exorbitantly high, and people are not going to be able to use those pools to get health care coverage, or states are going to have to come in and invest more than they would have under the Affordable Health Care Act.
PJ, are you in a situation where either you're getting the federal funding with strings from Washington or state funding with strings from Tallahassee, and it's basically the strings are tying you into knots?
That's an interesting analogy. I hadn't thought of it that way. We have our challenges, we really do, because there's a lot of expectations that often aren't driven by the treatment needs in terms of how things are allocated and the expectations around how funding is used.
Specifically,
well,
what do you mean?
If we had the flexibility to provide the continuum of care for individuals, never mind what silo they fit in and what category they're in, that we could give them the care, we'd see marked changes in terms of what people could experience. If they could get the medication-assisted therapy while getting involved with residential care on an equal continuum. This is a chronic disease. If you were to limit, just like diabetes, if you were to limit how many insulin shots someone got and say, come back in January and we'll give you 5 more when you're ready, I mean, would anybody who had diabetes tolerate that experience? But that's how we live oftentimes in the substance abuse and mental health world.
You know, and we haven't even covered, people who have private insurance, and the addiction, the coverage for addiction services is even limited in that. And most families, even if they have private insurance, cannot afford this. Anyone?
There's a lot of things in life that can't be afforded. One of the problems that I have in the conversation here is when we talk about cutting millions from Medicaid, and so we're going to be putting several million at risk. There were also, even at this point, there were a lot of people that weren't covered. The solution is always more money, more money, more money. But the problem is that never actually fixes problems. Clearly, in this case, in an opioid epidemic like this, we might need more money. But the concept that we always just need to spend more money, and any time we try and retrench at all, we're causing damage, I think that's a poor philosophy also.
You're saying in this case we may need more money?
In the opioid one?
Yes.
Yeah, we may.
Okay. Let's take a quick break, and when we return, we'll have final thoughts from our guests, plus what some of our viewers are saying about Friday's topic, the fallout from the firing of James Comey. Could the American Health Care Act impact opioid addiction treatment in states sorely needing it, and what more can be done to help those who are suffering? Our guests join us right now for final thoughts. And Frank, I know there was something that you wanted to say in terms of where we're going with the Affordable Care Act, and what is that?
Well, I don't know what's going to happen with this bill that's coming out of the Senate. Whether I think it will come out of the Senate, whether you can reconcile the House and the Senate version, I'm not so sure. I do think there are some changes that need to be made to the Affordable Care Act, particularly in the state insurance markets. It's just a problem that's going to take a while to fix.
You know, Ryan, you're president of the Republican Club here, but you do have a problem with the way your party has handled this entire debate in terms of the party has been against the Affordable Care Act for these 8 years, got into office, and does not have a well-worked plan
Right. Well, for real conservatives like me within the Republican Party, we've long been frustrated that the party people Republicans tend to run to their base and then govern somewhere to the center. You know, that's like that fixed wisdom we have out there. So they're always promising repeal Obamacare. Then when they were in office and when, you know, President Obama, a Democrat, you know, was in office, they were able to pass all these bills that they knew darn well were never going to see the light of day. Then once we have all three branches like we wanted, like we all pushed for and wanted, then they're totally unprepared with what to do, and it sort of felt a little bit like we don't have a campaign issue anymore. That's not what the base ever wanted.
I do want to end this on some very good news, and PJ, it deals with the I believe 400th baby born.
411th.
Born not addicted to any.
Since our inception, we just as of today had our 400th child, female baby born today, and that represents you know, just huge. Just think about that. We have a child who has a clear start going into the world, and there's 411 of its peers that are now moving forward into the world.
Yeah, even with that good news, you have a real big reason to be concerned about your ability to continue with that mission.
We do. You know, we can argue politics. All I know is that from national on down to our state, we have declared this as a public health crisis. We have a state of emergency. Well, then, how do we address it? Well, I don't think we give it. We need to give it the attention it really, really needs. You know, and I think that includes however funding needs to be allocated, freeing up resources, however it needs to work.
And we'll have to leave it there. But before we go, we want to share with you what some of our viewers are saying about Friday's topic, the fallout from President Trump's firing of FBI Director James Comey. The search for a new FBI director is now underway. However, Washington is still reeling from the firing, which comes as the FBI is investigating possible collusion between the Trump campaign and Russia. Further complicating the matter, President Trump appeared to threaten Comey with a tweet suggesting their conversations were taped. Here's what some of you are saying. Dick Neal writes, people are just too ignorant to see what's really going on here. If you love this country, you had to get better a grip before too much damage is done by this moron. His approval rating is the lowest for one reason and one reason only. Mike Barbario writes, the more liberal heads continue to explode, the better. I can't get enough of this stuff. After enduring 8 years of hell, keep pushing your agenda, Mr. President, and let's move on to the next SCOTUS nominee this summer. Can't wait. Hashtag Make America Great Again. And Mike Gonzalez writes, there are more important issues facing our nation than this. Media is always trying to stir up drama. Enough. Let's move on. Hey, Mark, hate to break it to you, the media isn't stirring up drama. We're reporting what the president does, says, and yes, what he tweets. Has the opioid epidemic affected your family, and what do you think about funding for treatment? Join the conversation by visiting our Facebook page at facebook.com/news@7. And FYI, you can watch past Roundtable discussions on demand. They're available on Apple TV, Amazon Fire, and Roku. Thanks to our guests for being here tonight. PJ Brooks is Vice President of Outpatient and Youth Services at First Step Addiction Recovery in Sarasota. Frank Alcock is Professor of Political Science at New College of Florida, and Rod Thompson is the President of the Sarasota Republican Club.